Return now to the visit to South Africa by French President Emmanuel Macron. Of course, it comes at a crucial moment as we battle to vaccinate South Africa against COVID-19. There are many positive signs that France is willing to work closely with our country and help us in our quest to get more jabs. I'm joined now by Professor Alex van Heever, specialist in health economics and finance from the Wits School of Governance. Good evening. Thank you so much for your time. Listening to what President Macron said, he's basically saying that we need to sort out the pricing of these vaccines. We need to sort out the intellectual property rights on these vaccines. And he seems to be a real ally to South Africa and Africa.
I think this is an incredible window of opportunity where we can get unity where there has been considerable disunity internationally around both medicine and other aspects of pharmaceutical production and supply. So I think we really do have to grasp this moment, but we then have to look for mechanisms that will actually bring what this discussion has raised into something real.
The vaccine waiver issue is being pushed really hard by both the presidents. Of course, it's something that South Africa has been pushing hard for a couple of months now, along with India and the WTO. But it could take some time. They also have to put pressure on Big Pharma, who want to make their money back and then some. Is that the most critical issue, to open things up so that more countries can produce the vaccine? Is that the only way we can really sort out access at this point?
I don't think it is. I think that the production that's occurring around the world will probably be at full swing regardless. The prices are not necessarily the obstruction to access to vaccines. It's largely who's booked the doses, and that isn't necessarily dependent on the IP arrangements. The IP arrangements do have an impact on the final prices that companies sell at, and kind of deals with a different kind of problem. Our problem at the moment is being able to have a fair distribution of vaccine production, which really requires another set of arrangements.
And exactly. So the French president is basically saying we need to tackle both. We need to tackle price, and we need to tackle anything, essentially, that gets in the way of ramping up production. Fully in support of that waiver plan.
So the president...
Yeah, carry on.
No, sorry. The pricing issue and the TRIPS waiver arrangements and the IP arrangements are very much a kind of a medium to long-term issue. So even if we withdraw them tomorrow, they're not going to make much of a difference. So yeah, the real question is really on the design of a new sort of spatial distribution of vaccine production, and whether or not we can create viable arrangements within the African continent and work out a way to ensure that that is viable from a commercial perspective and available to all the countries within the African region.
You know, for the first time, I certainly heard from our president a real sense of frustration coming through. One thing Africa cannot do, we cannot continue to wait in the queue. We're tired of waiting in the queue. Is there blame to be laid for the fact that we are not further along in our vaccination program? We set goals, we keep missing them. We're now fully into our third wave, or we're pretty much hitting it on the nose. Could we blame government, or is it just a case of bad luck? AstraZeneca, of course, arrived, but then we realized it wasn't suitable for the dominant variant. The J&J doses manufactured at the Aspen factory in Gqeberha are ready and waiting, but we cannot get the regulators to open them up, I understand, because of what happened in Baltimore at a factory there with a mix-up. Can we blame government? Do they have a case to answer, or is it just a situation of bad luck and access issues which affects the whole of Africa?
I think that we had a risk which we could have anticipated, this was a problem that was predictable very early on in the pandemic. At the moment vaccines come online, and everybody was aware of the vaccine science going on and the vaccine trials. It wasn't a secret. The issue is that if you didn't book doses, you're not going to get them in time, and there's going to be a supply constraint, and people are going to end up at the back of the queue. What was clear is government didn't do anything during 2020. and only started to get into action early in 2021. So we don't know what kind of options we threw away in 2020 because we just didn't do anything and relied on COVAX. So I think that there is blame there, and but we are where we are, and we have to deal with the situation now. So vaccine nationalism was a predictable response, and which we could have anticipated, and some countries did. But I think that moving forward now, we're going to have to just continue to unblock the constraints to get supply through. We're already dealing with a situation where the private sector is not going to open up or even close down vaccine sites because supply is going to run out next week. So that's because Johnson & Johnson hasn't delivered. So we are getting more Pfizer doses, but they're not available yet because they're still going to go through the quality check. So this is all problematic, and I pretty much expected that this would happen, that we'd have stops and starts, not because of the expansion of the rollout, but because we're suddenly going to run out of doses. And this is the problem we're now going to really have to fight to solve. But I do think once Aspen comes online, a lot of this will go away and we can actually expand to full capacity. So a lot really rests on getting that story settled as soon as possible.
Yeah, absolutely. That has to come online sooner rather than later. Thank you so much, Professor Alex van den Heever, specialist in health economics and finance from the Wits School of Governance.